Eczema, also known as atopic dermatitis, is a common skin condition that causes itchy, inflamed patches on the skin. Diagnosing eczema can be a detailed process, as its symptoms often overlap with other skin disorders. In this video, we'll walk through the step-by-step approach doctors use to diagnose eczema, from the initial consultation to confirming the diagnosis. Understanding this process can help patients know what to expect during a medical visit and why each step is important for accurate diagnosis and effective treatment. The first step in diagnosing eczema is taking a thorough medical history. The doctor will ask about the patient's symptoms, such as when the itching and rash started, how long they've lasted, and whether anything seems to trigger or worsen them. Family history is also important, as eczema often runs in families and is linked to other allergic conditions like asthma or hay fever. The doctor may inquire about past skin problems, allergies, and any treatments that have been tried. This information helps narrow down the possible causes and guides the next steps in the diagnostic process. Doctors will ask patients to describe their symptoms in detail. This includes the location of the rash, the type of itching, and whether the skin is dry, cracked, or oozing. The timing and frequency of flare-ups are also important. Patients may be asked if the symptoms are worse at certain times of the day or after exposure to specific substances, such as soaps, detergents, or certain foods. This detailed symptom description helps the doctor distinguish eczema from other skin conditions that may look similar but have different causes or treatments. Next, the doctor performs a physical examination of the skin. They will carefully inspect the affected areas, looking for classic signs of eczema, such as redness, swelling, dryness, and thickened skin. The doctor may also check for scratch marks, open sores, or signs of infection. The distribution and appearance of the rash can provide important clues, as eczema often affects certain areas like the inside of elbows, behind knees, and on the face in children. This hands-on assessment is crucial for making an accurate diagnosis. Doctors pay close attention to the pattern and distribution of the rash. Eczema typically appears in certain areas, such as the flexures of the arms and legs, neck, and face. The presence of symmetrical patches or chronic thickening of the skin can be telling. The doctor will also note whether the rash is acute, with blisters and oozing, or chronic, with dry and leathery skin. These patterns help differentiate eczema from other skin diseases like psoriasis or contact dermatitis. During the examination, the doctor will look for signs of skin infection, which can complicate eczema. Signs include yellowish crusts, pus, increased redness, warmth, or swelling. Infected eczema may require additional treatment, such as antibiotics. Recognizing infection early is important, as it can worsen symptoms and delay healing. The doctor may gently press on the skin or take a closer look with a magnifying tool to assess for infection. Doctors assess the severity of eczema by evaluating the extent of skin involvement, the intensity of itching, and the impact on daily life. They may ask how much the itching interferes with sleep or activities, and whether the skin changes are mild, moderate, or severe. This evaluation helps guide treatment decisions and sets a baseline for monitoring progress over time. Severity scoring systems, like the Eczema Area and Severity Index, EASI, may be used in some cases. Since eczema is often associated with allergies, doctors will review the patient's history of allergic conditions. This includes asthma, hay fever, or food allergies. The presence of these conditions, known as the atopic triad, increases the likelihood of eczema. The doctor may ask about seasonal symptoms, reactions to certain foods, or environmental triggers like pollen or pet dander. Understanding the allergic background helps in both diagnosis and management. Doctors often ask about family history because eczema tends to run in families. If close relatives have eczema, asthma, or allergies, the risk is higher. The doctor may inquire about parents, siblings, or even grandparents with similar skin problems or allergic conditions. This information supports the diagnosis and may influence recommendations for prevention and management, especially in children. Identifying triggers is a key part of diagnosing and managing eczema. Doctors will ask about exposure to irritants like soaps, detergents, fragrances, or certain fabrics. They may also discuss environmental factors such as temperature changes, humidity, or stress. Keeping a symptom diary can help patients and doctors pinpoint specific triggers that worsen eczema, leading to more effective prevention strategies. Eczema can resemble other skin conditions, so doctors consider a differential diagnosis. They may compare the patient's symptoms with those of psoriasis, contact dermatitis, fungal infections, or scabies. Each condition has unique features, so the doctor will look for distinguishing signs, such as silvery scales in psoriasis or burrows in scabies. This careful comparison ensures the correct diagnosis and avoids unnecessary treatments. In some cases, doctors may recommend patch testing to identify specific allergens that could be triggering eczema. Small amounts of potential allergens are applied to the skin under adhesive patches, usually on the back. The skin is checked after 48 hours, and again after a few days for any reaction. This test helps identify contact allergies, which can be important for patients with persistent or unexplained eczema. Skin prick testing may be used to check for immediate allergic reactions to common allergens. A tiny amount of allergen is placed on the skin, usually on the forearm, and the skin is pricked to allow exposure. If a raised bump appears, it indicates an allergic response. This test is more commonly used for respiratory or food allergies, but can provide useful information in some eczema cases. Blood tests are not always necessary for diagnosing eczema, but they may be ordered in certain situations. Doctors might check for elevated levels of immunoglobulin E, IgE, which is often higher in people with allergies and atopic conditions. Blood tests can also help rule out other causes of skin symptoms or check for signs of infection if the eczema is severe or not responding to treatment. In rare cases, a skin biopsy may be performed to confirm the diagnosis. The doctor removes a small sample of skin under local anesthesia and sends it to a laboratory for microscopic examination. This can help rule out other skin diseases that mimic eczema, such as cutaneous lymphoma or psoriasis. Biopsies are usually reserved for atypical or treatment-resistant cases. Doctors use specific diagnostic criteria to confirm eczema. These include major features like itching, chronic or relapsing course, typical appearance and distribution, and personal or family history of atopy. Minor features may include early age of onset, dry skin, or other atopic diseases. Meeting a combination of these criteria supports the diagnosis and helps standardize care. One widely used set of diagnostic criteria is the Hanifin and Rajka criteria. It includes 4 major features: itching, typical morphology and distribution, chronic or relapsing dermatitis, and personal or family history of atopy. There are also several minor features, such as dry skin, ichthyosis, or elevated IgE. This structured approach helps doctors make a confident diagnosis, especially in complex cases. Doctors evaluate whether the skin condition is chronic or relapsing, which is a hallmark of eczema. They ask about the duration of symptoms and whether there have been repeated flare-ups over months or years. Chronicity helps distinguish eczema from acute skin reactions, which usually resolve quickly. This information is key for both diagnosis and long-term management planning. Eczema often begins in childhood, so doctors will ask about the age when symptoms first appeared. Early onset, especially in infants or young children, supports the diagnosis of atopic dermatitis. However, eczema can also develop in adults, so age of onset is just one piece of the puzzle. This information helps tailor treatment and anticipate the course of the disease. Dry skin is a common feature of eczema. During the examination, the doctor will check for areas of dryness, scaling, or roughness. Patients may be asked about their skincare routine and whether moisturizers help. Persistent dryness, especially in combination with itching and rash, points toward eczema and helps rule out other conditions. Lichenification refers to thickened, leathery skin that results from chronic scratching or rubbing. Doctors look for this sign during the physical exam, as it is characteristic of long-standing eczema. Lichenified areas may appear darker and have prominent skin lines. Recognizing this feature helps confirm chronic eczema and guides treatment to reduce itching and inflammation. Doctors will ask about other atopic diseases, such as asthma or allergic rhinitis, which often occur alongside eczema. The presence of these conditions strengthens the diagnosis of atopic dermatitis and may influence treatment choices. This holistic approach ensures that all aspects of the patient's health are considered in the management plan. Eczema can significantly affect a patient's quality of life. Doctors may ask about sleep disturbances, emotional distress, or limitations in daily activities caused by itching or visible skin changes. Understanding the impact on quality of life helps prioritize treatment goals and may prompt referrals for additional support, such as counseling or support groups. In some cases, doctors may take photographs of the affected skin areas to document the extent and appearance of eczema. This can be helpful for tracking changes over time and assessing the response to treatment. Photographic records provide an objective way to monitor progress and adjust the management plan as needed. Educating patients about eczema is an important part of the diagnostic process. Doctors explain the nature of the condition, common triggers, and the importance of skincare. They may provide written materials or recommend reputable resources. Patient education empowers individuals to manage their condition effectively and recognize early signs of flare-ups. Once the diagnosis is confirmed, doctors work with patients to develop a personalized management plan. This may include recommendations for moisturizers, topical steroids, or other medications. Avoiding triggers and establishing a regular skincare routine are emphasized. The plan is tailored to the severity and pattern of eczema, as well as the patient's preferences and lifestyle. Regular follow-up visits are important for monitoring the course of eczema and adjusting treatment as needed. Doctors assess the effectiveness of the management plan, check for side effects, and address any new concerns. Ongoing communication helps ensure that patients receive optimal care and achieve the best possible outcomes. If eczema is severe, unresponsive to standard treatments, or complicated by other conditions, doctors may refer patients to a dermatologist or allergist. Specialists can offer advanced diagnostic tests, prescribe stronger medications, or provide specialized therapies. Referral ensures that patients with complex cases receive expert care. Doctors may use standardized tools to assess eczema severity, such as the Eczema Area and Severity Index, EASI, or SCORAD. These tools provide objective measures of skin involvement and symptom intensity. Severity scoring helps track progress, compare treatment outcomes, and guide research. It also ensures consistency in clinical practice. Doctors check for complications that can arise from eczema, such as secondary infections, scarring, or pigment changes. Early recognition of complications allows for prompt intervention and helps prevent long-term damage. Patients are advised to report any new or worsening symptoms between visits. Evaluating how well the skin responds to treatment is an ongoing part of eczema management. Doctors ask about symptom improvement, side effects, and adherence to the treatment plan. Adjustments may be made based on the patient's feedback and clinical findings. This step ensures that therapy remains effective and safe. Eczema can affect mental health, leading to anxiety, depression, or social withdrawal. Doctors may screen for psychological symptoms and offer support or referrals as needed. Addressing the emotional impact of eczema is essential for holistic care and improving overall well-being. Sometimes, patients with eczema may also have allergic contact dermatitis. Doctors consider this possibility if the rash appears in unusual locations or does not respond to standard treatments. Patch testing or reviewing exposure history can help identify additional allergens that need to be avoided. In some cases, especially in young children, food allergies may contribute to eczema flare-ups. Doctors may ask about reactions to specific foods or recommend elimination diets under supervision. Food allergy testing can be considered if there is a clear link between eating certain foods and worsening eczema. For adults, occupational exposures can play a role in eczema. Doctors ask about work environments, contact with chemicals, or frequent hand washing. Identifying occupational triggers is important for both diagnosis and prevention, and may require workplace modifications or protective measures. Doctors consider irritant contact dermatitis if the rash is localized to areas exposed to harsh chemicals, soaps, or frequent washing. This condition can coexist with eczema or mimic its appearance. Careful history and sometimes patch testing help distinguish between the two and guide appropriate management. Chronic eczema can lead to secondary skin changes, such as pigmentation changes, scarring, or thickening. Doctors look for these signs during the exam and document them for future reference. Recognizing secondary changes helps in evaluating disease duration and the effectiveness of treatment. Although rare, doctors will ask about systemic symptoms such as fever, fatigue, or swollen lymph nodes. These may indicate a more serious underlying condition or a complication of eczema, such as widespread infection. Prompt recognition and further investigation are important if systemic symptoms are present. Patients with eczema are at increased risk for viral infections, such as eczema herpeticum caused by the herpes simplex virus. Doctors look for clusters of painful blisters, fever, or rapid worsening of eczema. Early diagnosis and antiviral treatment are critical to prevent serious complications. Bacterial infections, especially with Staphylococcus aureus, can complicate eczema. Doctors look for signs such as increased redness, warmth, pus, or yellow crusting. Swabs may be taken for laboratory analysis if infection is suspected. Prompt treatment with antibiotics may be necessary to control the infection and improve eczema. Fungal infections can sometimes mimic or complicate eczema, especially in areas like the feet or groin. Doctors look for ring-shaped rashes, scaling, or persistent symptoms despite standard eczema treatment. Skin scrapings may be sent for fungal culture to confirm the diagnosis and guide therapy. Scabies, caused by mites, can resemble eczema and cause intense itching. Doctors look for burrows, especially in the web spaces of the fingers, and may take skin scrapings for microscopic examination. Correctly identifying scabies is important, as it requires specific treatment to eliminate the mites. Psoriasis is another skin condition that can be confused with eczema. Doctors look for well-defined, silvery, scaly plaques, often on the elbows, knees, or scalp. A careful history and examination help distinguish between the two, as treatments differ significantly. After completing the history, examination, and any necessary tests, the doctor makes a final diagnosis of eczema. They summarize the findings, explain the diagnosis to the patient, and discuss the next steps in management. This comprehensive approach ensures that patients receive accurate information and a clear plan for moving forward. Diagnosing eczema is a step-by-step process that involves careful history taking, physical examination, and sometimes additional tests. By following this structured approach, doctors can accurately identify eczema, rule out other conditions, and develop an effective management plan. Understanding the diagnostic process empowers patients to participate actively in their care and achieve better outcomes.